Hello everyone, my name is Suhan, Doctor of Physical Therapy. Do you have any pain over the area between your shoulder blade to your spine? If so, then I have very effective exercises for you, and I'll also tell you what conditions to work the best. Stay tuned. There are 3 conditions for maximizing those exercises to be beneficial. First, you have medial scapular winging. It is defined by when your shoulder blade is positioned more inward. So basically your shoulder blade is getting closer to your spine. Second, you have pain described as deep and dull, and you also feel tightness. And third, you may have scoliosis that on one side that's getting closer to your shoulder blade. If you have any of the following, like one of the factors, then you can have those exercises to be really beneficial and decreasing your pain. Before we dive into exercises, let's loosen up the tight rhomboid muscles. We can simply massage over the area by using any hard ball like a golf ball or a lacrosse ball. Place it over the painful area. Gently press it until you feel enough pressure and hold it for 10 seconds. You can also move it around to find other tight area between your shoulder blade to your spine. Let's repeat 5 times, and this should decrease your rhomboid muscle tightness. So for our next thing, we're gonna stretch your rhomboids. And there are 2 ways to do it, and I'm just gonna show you both of them so you can choose the one that works the best for you. The first way to do it is I'm gonna have you grab your hands like this way, and I'll show you from the side. And I want you to bring your arms and your shoulder blades forward. When you bring your arms and shoulder blades forward, I wanna make sure that your torso is not moving along with it. It's just gonna be your arms and shoulder blades, and when you feel your muscles between your shoulder blades stretching, that's exactly where it needs to be. I want you to hold it for 10 seconds, and we're gonna repeat that for 10 times. So for another way to stretch your rhomboids, we're gonna use this type of wall. I want you to cross your arms, and then bring your feet position more forward with keeping your knee slightly bent, and I want you to let your body hang. So you're gonna feel good amounts of stretching between your shoulder blades. Once you feel the stretch, I want you to hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and bring it up. And we're gonna repeat this for 10 times. Lastly, we're going to strengthen serratus anterior muscles, which brings your shoulder blades forward as we strengthen them. I'll show you in 2 ways, one with single arm exercise and another with bilateral exercise. So bend your elbow to 90 degrees and place your elbow to neutral position, not too inward, not too outward. And I want you to slowly bring your arm towards ceiling. And when you do that, you should feel your side of your torso activating or your muscles right below of your armpit. I'll show you from the side. And you can always progress your exercise by adding some weights. So this is harder than it looks, so you don't have to add a lot of weights for this exercise to be beneficial. For the second exercise, you can use a long TheraBand like this one. I want you to wrap this around and adjust the length of the band so we feel enough tension. And I want you to make your elbow straight with your arms straight up with slight upward direction so that your shoulder blades are moving forward. Just like this way. And when you feel your muscles over the side of your torso or your muscles right below your armpit activating, that's exactly where it needs to be. And we're gonna try 2 sets of 10 repetitions. How's that feel? If the video helped you for subsiding your pain or if you enjoy watching it, please support my channel by hitting the like button or subscribing to my channel.